Good morning, everyone. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to today's webinar on Is Your Joint Health Weighing on You? Presented in collaboration with Friends Health Connection. Being overweight increases stress on your joints, particularly your knees and hips. Those who are overweight are 4 to 5 times more likely to get arthritis in their knees. In fact, obesity has been identified as a modifiable risk factor for osteoarthritis. During today's webinar, we will learn more about the impact of weight on joint health, strategies to lose weight and strengthen joints, and surgical options such as weight loss surgery and joint replacement surgery. We are pleased to be joined by Marcella O'Herlihy, a registered nurse who is the coordinator of Robert Wood Johnson University Hospital Somerset's Joint Surgery Program, and Sandra Collado, a registered nurse who is the coordinator of Robert Wood Johnson University Hospital Somerset's Bariatric Surgery Program. Thank you both for joining us. So we're going to begin our webinar with a presentation from our speakers, followed by question and answers from our audience. If you do have a question for either presenter, please post them in the question and answer section of our webinar today. Thank you again, and without further ado, I will turn it over to the ladies.
So good morning. My name is Serena said. My name is Marcella O'Herlihy. I'm the joint coordinator for Robert Wood Johnson Somerset. Next slide, please. And I'm going to tell you a little bit about our joint replacement center. We have total hip and total knee, and it's a personalized approach to joint replacement surgery. We do have a certification for our total hip and total knee program, and this is through Joint Commission, which we are reviewed every 2 years, and our program is inspected, and our certification relies on us reaching the standards required by the Joint Commission during their inspection. For our total joint replacement patients, we have a dedicated unit, a standardized plan of care. Our patients and family are included in all of our education and our preparation prior to surgery. All of our staff are educated in the care of the total hip and total knee replacement patient. And we provide individualized care and a joint coordinator to walk you through from the beginning when your surgery is scheduled to well into your recovery and beyond. We have several orthopedic surgeons. If you are looking for their telephone numbers or their addresses, if you just look up the Robert Wood Johnson Somerset website, you'll be able to get their contact numbers there. Our patient must be cleared medically before coming in for surgery. We have a strong focus on health and are available to offer many resources for a full recovery. It is truly a team approach. Once you and your surgeon decide you are ready for total joint replacement surgery, our team is in place to assist you throughout your journey. Our team consists of orthopedic surgeons, physician's assistants, a total joint coordinator, RNs, physical therapy, occupational therapy, social work, case manager, and visiting nurse service and home physical therapy. So a coach is a friend or a family member, and coaches are invited to the class. They come to observe patients doing physical therapy. All of this is to make the patient and family comfortable with our patients returning home after surgery. They get to hear the instructions, and the patient is given a lot of instructions, and then they also get to ask a lot of questions. So this is what our joint replacement rooms look like. Please note, we do not use any trapeze anymore. We have 24 private rooms, and we want this room to look as close to your bedroom at home as possible. You have a recliner, we have a pull-out couch, and a hospital bed, and your own private bathroom. We also have a private joint surgery studio where you will do most of your physical therapy. We do a lot of discharge planning. Physical therapy will come to see you within 24 hours of you being discharged home after your surgery, even on weekends and holidays. And the joint coordinator will follow up with you after you have gone home. Most of our joint replacement patients go home and they continue their therapy at home. Weight loss and how it affects joints. It'll allow you to feel more comfortable in your own family surrounding when you go home, but joint stability and motion and strength is really dependent on weight as well. So you will need to do things like get in and out of bed, in and out of a chair, walk long distances, go up and down the stairs. So having a lot of weight can hinder your progress as well. It has been recommended by orthopedic surgeons that patients lose weight prior to undergoing total hip and total knee replacement. Bariatric surgery is an option for those patients to meet this goal. Losing weight can help provide a patient with much better outcomes. New research shows that obese patients are up to 4 times more likely to develop knee osteoarthritis as they are to develop high blood pressure or type 2 diabetes. Osteoarthritis of the knee is the most prevalent form of large joint osteoarthritis in the world. So the danger to your health and quality of life is insidious. For obesity at every stage, excess body weight can increase the level of pain and disability, and it undermines the efficacy of treatment. High blood pressure and diabetes can be controlled with weight loss, but osteoarthritis is irreversible. Excessive loading on the joint from obesity can cause osteoarthritis, the wearing away of the surface of the bone. It forms in the weight-bearing joints, the hip or the knee, and most, we feel that the knee more so than the hips. The effect of excess weight can be 4 to 5 times greater, and it'll cause poor posture and unhealthy gait are more common in obese patients. Research shows that nearly 50% of obese patients have a poor outcome from joint replacement surgery, compared to less than 10% with healthy weight. And now I'm going to turn it over to Sandra, who's going to talk about the bariatric program.
Thank you again for joining us. I'm Sandra Collado, bariatric program coordinator here at RWJBarnabas, Somerset. So what is bariatrics? Bariatrics is the branch of medicine that deals with the study, treatment, and prevention of obesity. Many people think that bariatrics automatically equals surgery. However, it does not. Bariatrics also involves healthy weight, achieving it, and maintaining it. And this can be done via non-surgical weight loss options as well, which we do offer here. About the program. So we are an accredited center of excellence in metabolic and bariatric surgery. And what this means is that we have met and exceeded a number of rigorous criteria in safety, quality of care, and outcomes, and are also subject to an on-site inspection of our facility, which includes every area that our patients travel through. This includes pre-admission testing, the emergency room, the operating room, the ICU, if need be, that a patient should have to go there. And it also our inpatient units are also viewed at the time of inspection. This program is reviewed every 3 years. We have also been nationally recognized in patient safety by Leapfrog. Leapfrog is a safety grade for hospitals, and there is a unit of measure there for infection rates, errors, practices around safety, and 24/7 physician coverage in the ICU units. We perform about 100 surgical cases per year, and we have less than a 1% readmission rate. Our multidisciplinary team, this includes healthcare providers who specialize in all pieces of weight loss. This, again, it includes the non-surgical piece, which is medical management, includes surgery, nutrition, behavioral health, and exercise as well. This program is supported by a certified bariatric nurse and a navigator to help coordinate your care among these providers. As a team, we provide a lot of education and support from the physiological changes as well as the insurance benefit aspect. So what is obesity? Obesity is a condition characterized by excessive accumulation and storage of fat. It is a leading cause of disability and death. It impacts nearly every organ of the body. Some contributing factors to obesity are genetics, metabolism, economic status, behavioral and environmental factors also. What is BMI? BMI is a measure of body fat based on height and weight. It applies to both men and women. It is a measure of body size, and it combines a person's weight with their height. BMI is calculated by dividing the weight of a person in kilograms by the square of their height in meters. BMI can give an idea about whether a person has the correct weight for their height. It is used as a tool to screen for potential weight problems in adults and children as well. A BMI of 25 to 29.9 is considered overweight, and a BMI of 30 to 34.9 is considered obese. So what are some weight loss strategies? Well, there are two weight loss strategies that we will discuss. The first is the non-surgical weight loss option, and the other is the surgical weight loss option. So non-surgical is nutritional support with a registered dietitian. This can be combined with medication prescribed by one of our surgeons, or it can be done without medication. As far as medication goes, right now there is a new medication on the market and people are having good responses with very minimal side effects. The medication is called Wegovy. Our dietitians that you would be working with will teach meal planning and tips. They'll teach you how to use and keep a food diary. They'll discuss vitamin supplementation and provide support for you as well. This program is tailored to your individualized needs. Our dietitians take into account food allergies, food restrictions, and try to help you get into healthy habits, depending also upon your schedule and your lifestyle. So it's a very supportive and comprehensive program. For surgical weight loss, we are currently performing two different types of weight loss surgery here at our hospital. The first is the sleeve gastrectomy, and the second that we'll discuss is the gastric bypass, which is also called the Roux-en-Y. So with the sleeve gastrectomy, as you'll see in the photo there, the inner portion of the stomach is cut and it is then stapled off. The outer portion is then removed from the body. This procedure leaves you with a banana-sized stomach pouch. The outer portion of the stomach that's removed, in that top outer portion of the stomach, there is a hormone secreted there called ghrelin. What ghrelin does is when the stomach is empty, it is secreted and it alerts the body to let you know, hey, it's time to eat, I'm hungry. When this portion of the stomach is removed, the ghrelin is then removed also. This, coupled with the new banana-sized pouch, patients will then feel less full because the pouch is much smaller. The new stomach is much smaller than it was before, which means you are limiting the amount of food that you can put into that pouch as opposed to what it was pre-surgically. And coupled with the fact that the outer portion of that stomach is removed where the ghrelin is produced, this also leads patients to feel more satiated and more satisfied when they do eat. And the decreased consumption results in decreased calories, resulting in increased weight loss. With the gastric bypass, an egg-sized pouch is created, and the lower intestine is then routed up and connected to the new pouch. As you can see there in the photo, you see the appearance of a Y there between the two intestines. Hence, that's where the Roux-en-Y piece comes in. The remainder of the stomach, where the egg pouch is created, that remainder of the stomach is stapled off and bypassed, but it remains connected to the lower intestine. So the new anatomy also results in a restricted intake because the size of the new stomach pouch, and it also results in a malabsorption of calories because of the rerouting of the intestines. So who is a candidate? Anyone with a BMI of 35 and at least 2 comorbidities. The 3 comorbidities listed there are the 3 that every insurance company will take and approve. They are diabetes, high blood pressure, and sleep apnea. A BMI of 40 with no comorbidities is a surgical candidate. Anyone who's experiencing obesity-related quality of life issues is also a candidate. And anyone who has attempted to lose weight using non-surgical weight loss methods and has been unsuccessful is also a candidate. So what are some of the symptoms of, what are some of the benefits of weight loss? Disease or symptom resolution, improved mobility and reduced pain. And this goes back to what my colleague Marcella was discussing earlier, with the decrease in the weight on the joints, you're going to have improved mobility and the pain is going to be reduced. You'll sleep better, you'll have increased energy levels and higher self-esteem. So I have some numbers here for you. We have seen statistics show a 40% improvement in migraines, 47% reduction in depression, 71 to 84% decrease in high cholesterol, 47% resolution in high blood pressure, a 45 to 68% resolution in type 2 diabetes. And about 80% of our patients lose about 75 to 85% of their excess body weight, and they keep it off for 5 years or more. Are there any questions?
Thank you, Sandy. Thank you, Marcella. So if you do have questions for either one of our panelists, please post them in the Q&A section of the webinar. So ladies, while we're waiting to see if our audience has any questions, what is the one thing or the most important thing that people can do you feel to, take the pressure off joints, in terms of losing weight? Would that be diet, exercise? What would you recommend?
Well, for
Sandy?
For joint replacement, it is definitely much better if you are exercising prior to coming in for surgery. You're going to be using your upper body, you're going to be using your arms to get, to sit up and get out of a chair. So if you haven't been exercising for a long time, those muscles are going to hurt. Reducing the amount of pressure on your joints because of your weight will help you tremendously as well. So going for an exercise program, of course, consult with your doctor first, but that is a really good step, first step.
Wonderful. Thank you so much. And we actually have a question from one of our audience members. Can you discuss aging, sore joints, arthritis, and ways to cope without surgery? Marcella, do you want to take that one?
Yes. So getting an evaluation with a physical therapist is a good thing. It could be posture is causing the pain. It could be a lot of different things. If your primary care physician has suggested that you go to see an orthopedist, they will do an x-ray to see how your joints are. Is there any wear and tear on your joints? And then again, physical therapy, exercising, maybe a nutrition consult. And definitely if you are clinically obese, having a consultation with somebody like Sandra is definitely going to help you.
So here's another question for you, Marcella. And I'm sure there's a little inside understanding to this. I love the trapeze over the bed. You mentioned it is no longer in use on your unit. I am curious to why it is not longer used. What was it harmful in some way?
So our method of surgery has improved so much in the past few years that patients, especially our anterior hip patients, once they leave the OR, they could literally walk off the OR table. And so patients are able to walk on the day of surgery. They do have a physical therapy evaluation. We teach you how to walk to the bathroom, walk in the hallway with assistance. But the need for the trapeze is no longer there. And patients do so well that actually some patients go home on the same day that they have the surgery because they have progressed so much that they are able to walk 300 feet. They're able to do the amount of stairs needed to get them into the first floor of the home, and they're able to get in and out of our car simulator. So because the surgery has changed so much, we have a much quicker recovery.
Great. Thank you, Marcella. Any other questions for our panelists? Sandy, now you might have mentioned this, but what are some of the other benefits to, bariatric surgery? I've heard in the past that, people who were diabetic, their numbers, they were no longer, or if they were pre-diabetic, were no longer pre-diabetic and getting that. Could you maybe briefly speak to that? What are some of the other benefits, aside from, the benefits to the joints?
Well, a lot of our patients that have come in needing CPAPs will no longer need them once they have had their surgery and have lost a significant amount of weight. They're not needing their CPAPs anymore. Resolution of blood pressure, like I said, high blood pressure, diabetes. There is not a cure for diabetes. However, weight loss surgery is a tool where our patients have been very successful with lowering their blood sugar after surgery. A lot of our patients have decreased the amount of medications that they've been on post-surgery. Yes, there's definitely the benefit physically with the decrease of the pressure on the joints, but the increased self-esteem, being able to perform activities that they have not been able to perform in years or maybe even ever. Just a general well-being, a sense of well-being, a lot of resolution in lab values. So there are a lot of benefits to taking that weight off.
Thank you for that explanation, because I'm sure, while it's going to help joints, like to your point, there's going to be so many other benefits in doing so as well. So here's another question from one of our audience members. What is usually used for pain control post-op for knee or hip replacement in the first day or so?
So for our, in general, we do use a lot of Tylenol. So if your pain is mild, we will give you high doses of Tylenol, and that does help tremendously. For our knee replacement patients, we do something called a nerve block. And this nerve block is inserted prior to the surgery. Once you have your surgery, the nerve block is turned on. It locates the nerve in the front of your thigh that affects the front of the knee where the incision would be. This nerve block drips medication on the nerve, and the nerve feels very numb. The medication is very similar to lidocaine that the dentist uses, so that numb feeling you would have in your jaw is the same numb feeling you would have in the front of your knee. This particular nerve block comes in a little pouch, and it goes home with you. It goes for 72 hours, so it gets you over the first few days of pain with knee replacement. And then we teach you how to remove it. And then at that point, you're probably down to just using Tylenol or maybe 5 milligrams of a stronger pain medication. For our hip replacements, we do give them Tylenol as well, and some mild narcotic pain medication. They seem to do a little bit better than the knees, and that's why we have this nerve block for the knee patients.
Very good. Thank you so much, Marcella. Any other questions for our panelists? Well, and their information is posted for you. So if you do have any questions or think of any outside of this webinar, please feel free to reach out to either one of them. So if there are no other questions, then this will actually conclude today's webinar. We want to thank you all for joining us. Thank you, Sandy. Thank you, Marcella. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 1-888-724-7123. For more information about joint replacement surgery or bariatric surgery at Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset. On behalf of Robert Wood Johnson University Hospital, Somerset, thank you all for joining us this morning. Have a great day.
Thank you. Bye-bye.
Thank you.